Let's see. Are we on? Are we on? Yeah, there we go. Okay. All right. So this is Taisha. This is part two of my breast lift surgery journey. And if you have not gone to watch my first video, please go catch up. It talks about why I'm having breast lift surgery and how I got to this point. And then go catch up. Come back. Today I'm going to just talk about where I am over the last week. I'm having surgery on the 22nd and I'm posting my journey because when I went on YouTube and when I searched Instagram, I could hardly find anybody talking about having a breast lift, especially anyone of color, talking about having a breast lift without an implant, okay? And so this journey is a little bit different than having an implant surgery or a breast augmentation. And so I just wanted to give another perspective so that when people search, maybe they find me and they can get some more information or a testimonial or another perspective about the ins and outs of this journey. So today I went and got some lab workups requested by my cosmetic surgery performed by my primary care doctor's office. And so I want to just talk about all the stuff that my surgeon is having me to do prior to surgery in the next almost 2 weeks. So all right, so the first thing is first. So they told me to stop eating certain things. I had to get my diet in order. I'm not a smoker, but had I been a smoker, they told me that I would have to have stopped smoking like now. Like you should not be smoking if you are trying to have surgery because it is going to not help you heal well, okay? And so everyone knows that you're going to get sliced on. So you want to make sure that your body is in optimal condition to recover well, okay? And smoking does not help that. All right, but they also told me that I needed to, 2 weeks prior to surgery, I needed to stop eating anything that made my blood thin. And so you guys, they gave me this whole list. Let me show you this list. This list, can you see? Can you see everything? This light is bright. Can you see this list? This whole list of things that I had no idea thin my blood. And when you have your blood thins, then it's a little bit more difficult for it to clot and to do all the things that it needs to help you recover. But just main things that are on this list that I had no idea was things like celery, cod liver oil, what's on here? Evening primrose oil, fish oil, flaxseed, garlic, ginger, ginkgo biloba, ginseng green tea, honeysuckle, licorice, melatonin, onion, palm oil, saw palmetto, psyllium, turmeric, vitamin E, wild carrots, wild lettuce. These are the things that like I regularly eat, but I had no idea that they would do something to my blood that would prevent me from recovering well. And it says above are fine to eat but should not be taken in supplement form. It said to avoid NSAIDs, NSAIDs, Aleve, Motrin, ibuprofen, vitamins like magnesium, zinc, vitamin E, biotin, no allergy medications with a decongestant like Sudafed or Benadryl. Zyrtec is fine. Zyrtec D is a no. So pretty much I had to stop taking all of my supplements, my bariatric supplements. I stopped taking them altogether. To be honest with you, I had already stopped taking them, but this gave me a reason to not take them, and I'm going to pick back up on them when I'm done with surgery. So that was the first thing. Had to get my diet in control, up my water intake, of course, and I started drinking more protein, and I'll talk about that in a little bit. So that was the first thing. So diet was the first thing. The next thing is that you have to get all your lab work done within 90 days of surgery. And of course, your PCP or your internist can do it and file it through your insurance so you ain't got to pay for it. Because what I did notice is that if the prescription comes from a plastic surgeon, some of our insurances will not cover the prescriptions. And I keep touching my phone because it's not focusing. I don't know why. But you have to get the mammogram, which I already had, and then you have to get a medical clearance by my doctor. So when I got the medical clearance, my primary care doctor just pretty much asked me about my heart, what condition my heart is in. Am I having heart palpitations? Am I having difficulty breathing? Like all those types of things, which is excellent. I'm so glad that they do that medical clearance, because I don't want no smoke, you guys. I don't want any problems. I want to wake up from this surgery and live my best life, okay? So those are the things. They're no longer requiring COVID tests. So that wasn't an issue. So those were the main instructions that my surgeon, my plastic surgeon, gave my medical doctor. And then in terms of the pre-op labs, they want you to do a CBC panel. They want you to do a full metabolic panel, which I cannot wait to see. I love getting a full metabolic panel because it lets me know exactly what's going on and what I need to do in terms of my eating. And then they want you to get a partial thromboplastic time activated CPT 87. I don't know what that means, but basically they took about 3 vials of blood, okay? And they're going to check to make sure that I'm in condition to recover from the surgery. And that my blood will actually clot. And so that is extremely, extremely important in wound healing. I did some research, you guys, on wound healing. It was amazing to know how, like, our bodies are so amazing in terms of keeping us safe and keeping us alive, in terms of knowing when we've experienced some type of trauma. Like, our body can't distinguish between actual, like, medical trauma and when we've had actual surgery. So it treats it all the same. And so it's just like, look, we're going to fight you. We're going to fight to keep this girl alive. And I love that about our body. Thank you, God, for making an amazing, amazing body for us. All right. So here are the things that they told me to do the day of or the week of. So 72 hours before surgery, no alcohol, because it can cause dehydration and it can make my blood thinner. Day of, no eating, no drinking after midnight the day before. That includes water, mints, gum, or otherwise. And they said if I do that, my surgery is going to be canceled. And I was like, y'all not going to cancel this surgery on the kid. So, all right, no nail polish, no makeup, no contact lenses. They was like, take your weave out, girl, if it has clips on them. So if they have like metal clips on them, you got to take them out. Hair and eyelash extensions are okay. Fingernails need to be clear or sheer pink only. No gels, no acrylics. Toenail polish of any color is acceptable, because they're going to be, I'm going on a general anesthesia, so they need to make sure that they can use my fingers to do that. All right. So they make sure that I'm going to have a button-up shirt, leave all valuables and personal items at home, wear loose clothing, button-up shirt, do not take any aspirin 2 weeks prior to surgery, no vitamin D, no herbal products, no diet pills. Tylenol is okay. But my daughter's waking up from her nap, you guys. And then they want me to bring all the medication that they gave me to the appointment. So let's get into this medication that they gave me. First of all, they gave me, can you see this? Let's see, is it going to focus? There we go. Hybocleanse. So this is a antiseptic skin cleanser that I'm going to use the day of surgery. So day of surgery just helps me to make sure that I'm extremely clean, because they're going to be cutting on me. They don't want any antibiotics. I mean, they don't want me to get any infection. So it's very, very important that my skin is clean, well clean. All right, so I'm going to wash with that. And they told me, again, I cannot use any kind of lotion. They don't even really want me to put on any deodorant, which was a little bit weird, but okay. And then they also gave me, let's go through them. So they gave me Keflex, which I'm supposed to start taking the day after surgery. That is an antibiotic, because what I've learned after researching is that when our bodies suffer a trauma, whether it's medical trauma or whether it's a surgery, what it does is it disrupts our internal balance. And so what happens is that our body starts to activate, and like, we got to fight off these infections. And so taking the antibiotic helps my body to recognize that it needs to balance itself back out, get itself together, so that it doesn't overreact. And so taking that antibiotic helps me to not get sick. All right. For pain, they gave me tramadol, 50 milligrams of tramadol, and I'm going to take 1 tablet by mouth every 6 hours for pain. And from what I've been researching is that for breast lift surgery, the recovery time is not that bad at all. And so I'm not going to be in a ton of pain. So some people even said they were okay with just taking a Tylenol, but I'm going to have this on deck just in case. And I have some old oxycodone that I may just pop if I need to, which I doubt if I need to, but we're going to see what it do. All right. Then they gave me some anti-nausea anti-nausea medication. They gave me Zofran, and they gave me a patch that they're going to put on me like right when I go in for surgery, so that when I wake up it's there. So that patch is so that if I were to get sick from nausea, I would be okay. All right. Then they also gave me Senna. This is Senna. Is this the Senna? Yep, they gave me the Senna. And the Senna is for constipation. And they told me to take a probiotic, which I already have been taking. And then they also gave me these Arnica tablets. And this is for healing. They want me to use these, and it's for healing. It says that it is, let's see, does it have what it's used for? When I researched it, it says that it's for muscle pain and stiffness, swelling from injuries and bruises. So if I am bruised, then that's what it's there for. And what else do I have here? They gave me, this is the center right here. All right, so those are my prescriptions that they gave me. I also got Mederma night cream for my scars, and I'm not going to be able to use this until maybe 2 weeks after surgery. And then my silicone-based scar cream is what I got for my scars as well. And then I got some bio oil left over that my sister gave me a couple of years ago that I'm going to use for my incisions. And so that is that. I'm super excited, you guys. So I wanted to answer a few questions though. One question was about breastfeeding. Like, am I concerned about breastfeeding? So here's the thing. Listen, I wanted 2 kids too. I wanted a boy and I wanted a girl, and I've had both that boy and I had that girl. So having kids is no longer a priority for me. However, I do desire to get married one day, and if I get married one day, I desire to have another child, and if I have another child, then there's a possibility that I may have to breastfeed again because I want to breastfeed. There's also a possibility that because of the surgery that I may not be able to breastfeed, but that possibility is pretty slim because they do not actually remove my nipple. They do not detach anything, the mammary gland. They don't play with any of that, so to speak. And so there's a chance that I won't be able to, but I'm willing to risk that chance because I really don't want another child, which is a little bit selfish. But look, I want to play a little bit. So that's that. I hope that answers your question. All right. The next question is what about bodacious body love, right? And so I have been talking a lot about loving your body, not just loving your body, because I don't like to use that word because sometimes I don't like what I see, right? And that's the reality of it. I don't believe in toxic positivity, but sometimes I look in the mirror and I don't like it. And what about just embracing where you are right now? That is all good. That is amazing. Like I saw this, commentary on a person, but I can't remember her name, but she's like a social media influencer, and she had the same experience that I had. So she went to this black tie affair. I think it was like the Grammys. She looked bomb, like she looked beautiful, and the dress that she wore, her breasts were like sagging. They were very, very saggy. She just had 2 kids, and so social media was coming for her, but I love how people were coming back for the people that were coming for her. So I am here for you embracing your body, just as I have learned to embrace my body. But here's the thing, embracing your body and accepting where you are does not mean that you don't want to continue to work on and progress in what you see when you look in the mirror. Like it's not mutually exclusive. And so you can be empowered to continue to work towards what you want your body to look like, if it's, in my opinion, if it's realistic, or if you choose to have surgery, whatever your choice is, you are empowered to make those choices for yourself, and you live with those choices for yourself. My thing was understand your why. Like I think that sometimes we go into these surgeries with other people's voices in our heads, or we look at our bodies and we dislike our bodies because of other people's voices, not our own. And so I'm all about you identifying your why and proceeding and moving based on your why as opposed to anyone else's. And so I don't think that we should be having surgery to boost our self-esteem, but I do think it's okay to allow it to add to the enjoyment that you get from your body, if that makes sense. Okay. All right. So that's my question that's my answer for you. I hope they answered your question. And one thing that I noticed, because what happens is that your surgeon is, if you ever decide to have the surgery, your surgeon's actually going to ask you, what do you want your breast to look like? What are your breast goals? And so I actually started looking at other people's breasts and I was like, no, no, no. And it's very important that those of us that are going to have this type of surgery, that we are very, very realistic in regards to what our expectations are. If you are not getting an implant, then you're not going to have a look that is implant-ish. Your breasts are not going to sit all the way up here and have that top pole fullness that you would have if you had an implant. Like, that's just not realistic. And so you're going to set yourself up for disappointment if you're thinking that that's what's going to happen. So I am very, very realistic. I know I'm gonna have some look, I am almost 45 years old. I am not going into this expecting to have like a 13-year-old or a 19-year-old or a 20-year-old's breast. Like, that is not what I'm looking for. I'm just looking for a little bit of encouragement for them, okay? That's all I want, so that I can wear the clothes that I want to wear in the way that I want to wear them, and not be sad about it, not be stressed about it. That's what I want. Well, I want to show you something, because what I did was I actually went to my own pictures and I was like, look, my breasts look good in this bra. It looks good. I'm going to show you these pictures right here. It looks really, really good to me, for my own personal taste. And so that's what I want, but I want it like that when my bra comes off. Like, that's my goal. My own body is my own body goal, even for breast surgery. Like, hey, make me like that. Make me like me. but yes, make me like myself without the bra. So that is what I guess my update is for this week. I've got all my medication. I am getting my bag packed. I am getting my support team. My sister's going to take me to the surgeon's office. She's going to wait for me. And my child's father is going to support me like afterwards. And so I am excited, a little bit anxious about what they're going to look like, because I'm like a triple D right now. And I want to kind of keep the fullness. I want to still be at least a D. He promised me I can still get to a D. They promised me I can still get to a D. So I'm hoping that I stay a D. We will see. I'm hoping I like them. I like a D, a full D. So that is my update. I don't think I have anything else. Yeah, I think I'm good. I will see you guys next time. Bye-bye.